This is a reminder. This is a reminder. Welcome, everybody. On behalf of the Utah AHEC, we are thrilled to have Cara Murray join us today for our Lunch and Learn series. Cara Murray is a home and community extension educator at the Utah State University, Uintah County. Her primary interests include healthy lifestyles, food, exercise, substance use disorder prevention, and food preservation. Cara received her undergraduate degree from the Utah State University. She received her certification from the National Nutritional Therapy Association and is currently pursuing her master's in public health in health education. She enjoys showing cattle, hiking, skiing, and long distance running, including running the Boston Marathon and ultra marathon trail running. Wow. She lives in Lapoint, Utah, on a family ranch with her husband and her daughter. We are so thrilled to welcome you, Cara. The time is yours.
Thank you. Thank you for that introduction. I am thrilled to be here today with you all. Today, I'm going to be discussing our Voices of Resiliency graphic novels series. Before we really dive into that, I want to give everybody just a look at the website I have created. I am based out of Uintah County, but I work in Duchesne County and Daggett counties as well. Is everybody here from Utah? I guess I don't even know that. Feel free to let's have an open conversation. You can just put in the chat if you're familiar with the area, but very rural communities. And in these rural communities, we find that the conversation of substance use disorder and harm reduction concepts are often something that isn't being discussed. And that's really the goal here of our Office of Community Wellness, is to open up these conversations. If you can see my screen here, this is a few of the programs that are out of our office. If you're familiar with Extension, Utah State University is Utah's land grant institution, and these all contain an extension, which is public education, usually free of cost or at no charge, or I'm sorry, at little cost or free of cost. Very informal education, very community-based. It is all evidence-based, just as a university would be. But again, it's community education. It began with agriculture and has kind of expanded into FCS, Family Consumer Sciences, and really the whole health and wellness spectrum, which includes substance use disorder. So we received a grant from SAMHSA for this graphic novels project. So anyways, back to the website here. The Tribal and Rural Opioid Initiative is kind of what began this program. The Ute Indian Reservation, the Uintah and Ouray Reservation, is here in Uintah County. And there's a gap we were finding between the tribal entities and the county or state. And so our goal was to bring those together. We hosted a opioid wellness summit last year here in Vernal, which brought the concepts of the medicine wheel and the holistic health and kind of the more tribal, spiritually based practices, along with the evidence-based practices, MAT treatment, medicine-assisted treatments for opioid use disorder. We had law enforcement people from the different recovery homes that are local. We had a powwow, which was for the entire community, which ended up being definitely the highlight. And then this last year, I don't know if anybody here was able to attend. We did have students attending the 2023 Rural Opioid and Stimulant Wellness Summit that was held in Price this year. And this one didn't have a tribal focus. It had more of just our Utah rural community focus. It turned out fabulous. I have all of these presentations on our website if anybody was interested in hearing from some of those speakers. it was a wonderful, wonderful summit. So anyways, a little bit about the website here. And then of course the Voices of Resiliency, Utah Stories of Substance Use Disorder, Stigma, and Harm Reduction. Every one of these books is available here for digital download just by clicking either on the link or on the book itself. We conducted interviews from 2018 to 2022. We asked people, these were all done voluntarily. And it was people in long-term recovery for the most part that volunteered their story. And we asked questions about stigma, about harm reduction. And we took those stories and we put them in these graphic novels. We were able to publish 4 stories. Again, these are people throughout the state of Utah. And then this guide here that really breaks down what is stigma, what are the harm reduction concepts, things like that, just to give communities and, even healthcare professionals and therapists, just a better understanding of substance use disorder. So again, these are all free for digital download, but I am sending out, they went out today actually, the full, oh, you can't see because of my screen, but the full series, everybody's receiving every book, including the guide, in one combined version. So you will have those to have on hand. And at the end of my presentation today, if we have time, I'd like you to kind of take off your clinical hat or your, however you want to say that, your educated view of things, and look at things from a perspective of the average person. There's discussion questions at the back of every one of these stories. And I want to ask a few of those today. And you can, put your responses in the chat if that's what feels comfortable to you. But every story has some discussion questions to kind of open people's mind and get them thinking, a little bit more about the person and about the story in which they heard. So I will begin. There we go. Okay, so just an overview of our presentation today. I'm going to be covering harm reduction concepts, which I'm sure everybody's familiar with. Harm reduction as public health and the goals of harm reduction. And then stigma, the power of cartoons. And then we will be reading Savannah's story. I'm not going to read it all. You'll be receiving it, like I said, but we'll go over the basics of it. Okay. So what exactly is harm reduction? Let me put my screen big here so I can see the chat. Okay. Harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. And for the context of what we do with in extension with the substance use disorder is specifically drug use, but not necessarily, it doesn't have to be. Harm reduction isn't just that alone. It can be wearing your seatbelt. It can be using sunscreen. So harm reduction covers a wide variety of things. Harm reduction services can reduce stigma associated with substance use and co-occurring disorders, distribute opioid overdose reversal medications like naloxone, reduce risk of infectious disease among people who use drugs, and reduce overdose deaths. There are several concepts of harm reduction, meeting people where they are, the use of person-first language, meaning instead of saying a person, or instead of saying a drug addict, you would say a person with a substance use disorder, or instead of saying the person is diabetic, that is a person with diabetes. You are not, your disease is what person first language is. The use of naloxone, the Never Use Alone hotline, medical assisted therapies. At the conference in October, there was a panel, and that video is up on the website if anybody was interested in watching it. But there was a panel of speakers, which included many in long-term recovery. And to many of those, Vivitrol was something that helped them and something that they recognize as a valid tool, in their toolbox, something that they very much appreciated having access to within their recovery. Some states have syringe exchange programs. I guess I should say some counties as well. Here in Uintah County at the health department, there is one, but it's very, there's a private number you call. It's very under wraps. It's not something that's being openly talked about. I'm sure in Salt Lake City, there's more options for that. And then again, harm reduction includes safe sex practices, HIV testing, and pathways to treatment and recovery. So the gist of harm reduction concepts is that they are built on a belief in and respect for the rights of people who use drugs. And harm reduction is also public health. Many strategies are evidence-based. I'm sure you know that means that they are backed and supported by scientific research and studies. Harm reduction recognizes the realities of certain risky behaviors and aims to address those from a public health perspective. It's an important approach in addressing public health challenges related to substance use, infectious disease, and other high-risk behaviors. And I've included what it's not. It's not rigid, it's not forced, it's not top-down, it's not abstinence only, it's not judgmental or moralistic. It's not based on punishment, and it's based on the idea that people who use drugs are not bad people. So the goals of harm reduction are to reduce harm to individuals and communities, to promote health and well-being, to provide non-judgmental and client-centered services, and then of course providing that bridge between addiction and recovery. Stigma is a barrier to these goals. I think we've all seen some sort of stigma in our lives. It doesn't necessarily have to be like a substance use disorder, but we've all experienced some sort of stigma. The three types of stigma that I want to cover are public, systemic, and self. The public stigma refers to the negative attitudes, beliefs, and stereotypes held by the general public towards individuals with a substance use disorder. This type of stigma often leads to discrimination and social exclusion. And you'll hear in Savannah's story, and as we go on, as you receive these other stories and read them, stigma was, one of the main factors in the interviews, in the stories that we found prevented people from seeking recovery. And it was the public stigma and largely the self-stigma as well. Public stigma can manifest in various ways, including social isolation, rejection, and the denial of employment opportunity. Negative perceptions can hinder individuals from seeking help and support, as the fear of judgment and discrimination may discourage them from openly discussing their struggles. Next, we have systemic stigma, which involves discriminatory practices within societal institutions, healthcare, criminal justice system, employment systems. These all negatively impact individuals with substance use disorder. For example, there may be policies or practices that limit access to healthcare services, which include addiction treatment. In the criminal justice system, individuals with substance use disorders may face harsher penalties, contributing to a cycle of incarceration rather than rehabilitation. Employment discrimination based on a history of substance use can also perpetuate stigma and make it difficult for individuals to reintegrate into society after they have sought treatment. In Jay's story, he faces that he has trouble getting housing, he has trouble getting a job. And another thing that we've noticed in conducting these interviews, in many of their stories, it took one person to show compassion, one person to offer that job, to offer a housing. So it's quite interesting what they recall, and many of it is one individual that stands out. And then, of course, the self-stigma. This occurs when individuals with substance use disorder internalize the negative beliefs and attitudes held by society. They may start to perceive themselves through the lens of the societal stereotypes, including feelings of guilt, shame, low self-esteem. Self-stigma can be a significant barrier in seeking help, as individuals may develop a sense of hopelessness and believe they are unworthy of support or treatment. Overcoming self-stigma is a huge factor in getting individuals into the recovery process. So we know that stigma is a negative social mark attached to people or groups based on characteristic or behavior. There's several ways that we can reduce stigma. Like I said, changing the language that we use, educating people on substance use disorder, and then the evidence-based treatment options as well. And we found that even within people who are using substances, and people in recovery, when somebody is using like medicine assisted treatment like Suboxone, there's a stigma around that as well, that they're not really in recovery or they're still using. And so, I mean, this stigma goes quite deep. So again, person first language, describing what the person has rather than what the person is. This avoids labels or adjectives to define someone. I gave a few examples earlier, but a person with diabetes, not a diabetic, or a person with cancer, not a cancer patient, or a person with bipolar disorder, not a person who is bipolar. So the language was another thing that was big in the self-stigma, and overcoming that, and again helping the people get into treatment was the way that they were being talked to in these situations. So continuing with stigma, stigma reduction is a complex and multifaceted challenge. While there's limited research on interventions, education has shown promise in reducing stigma, particularly when it comes to substance use disorder and mental health. Debunking myths is a crucial component of educational efforts. And then there are some key things related to reduction through education. The personal stories and testimonials. Sharing personal stories and testimonials is a powerful educational tool. Real life experiences can humanize individuals who are often stigmatized, fostering empathy and understanding. And we have done this through these graphic novels. Myth busting strategies. Systemically debunking myths and misconceptions is crucial. This involves providing clear, evidence-based information to counteract false beliefs and stereotypes. Highlighting the facts can help reshape attitudes and reduce stigmatizing behaviors. Back on our website, under the resources tab, is the Debunked podcast. That was ran through 2022, began in 2018, along with these harm reduction graphic novels. But it is a podcast that we did on NPR, is where you can find it. The episodes are still up. And it's called Debunked because that's exactly what we did. People with a substance use disorder talked, and they talked about the myths, they talked about the conceptions, they talked about stigma. So again, something to check out if you're interested. Contact-based interventions. Contact with individuals who have experienced stigma can be a potent educational strategy. When people interact with those who have firsthand experience, it often leads to more positive attitudes and reduction in stereotypes. With our opioid summits that we've done the past 2 years, they have been available for community members to come at no cost. They've been available to professionals, to therapists and counselors and doctors and families of those with a substance use disorder. And that was really the goal, is to put everybody together, people side by side, law enforcement even, to sit and to have those open conversations, which again is, education. Cultural sensitivity. Recognizing and addressing cultural factors is important for stigma reduction. Tailoring educational materials and interventions to be culturally sensitive ensures that the information resonates with diverse populations. We unfortunately don't have much diversity in these graphic novels, but on Utah State University's digital library, the rest of these can be found, the interviews, the oral interviews, and there's a wide variety of diverse populations and people's stories that are different from what we were able to get published thus far. So we're hoping to be able to get more published in the near future. Education should not only focus on dispelling myths, but also on building resilience and empowering individuals. This can include strategies for coping with stigma and fostering a sense of community and support. Okay, so the power of cartoons or comics when it comes to stigma and harm reduction and substance use disorder. These simplified drawings add something that words and photographs cannot do alone. So I'd like everybody, if you have your screen and you're looking at it, take a look at that first photograph. It's the picture of the man that's in the little box there. You see defined features, you know that is someone. We look at the next photo, it doesn't have as much detail. We can possibly see, that could look like a couple people. The next one down, starting to look more of a cartoony face. Excuse me. That person could represent thousands of people. We look at the very clear one, and then also like the stick figure, and we see that can represent all people. Universally, the cartoon requires you to use your imagination. There's more people it could be said to describe because it's really not much at all, and you have to really kind of think about that. So when we look at the drawing of the realistic face, we see one person. When you look at the cartoon, you can see many people, nearly all people, even yourself potentially. So I want to move on to Savannah's story, the power of comics and graphic novels. Our goal was to bring the readers into the personal story and to connect the readers with compassion and empathy. Savannah got married at a young age and pregnant at a very young age. She was 18 years old. She developed postpartum depression, and from that alone, she felt ashamed, something that she shouldn't be feeling that way. She had a lot of self-stigma behind that, and her husband offered her a prescription oxycodone that he had, and she says she'll never forget that first pill. As soon as that pill kicked in, it took away all the sadness, and I was in love. I was on top of the world, cooking and cleaning and taking care of my kid. My depression drained me, and the pills gave me energy and relief. I started taking them every day. I didn't know I could get addicted and die from them. Like I said, I haven't included every page of the story here. It's just kind of an overview. Savannah ended up running out of pills, and so she began stealing, getting pills off of the streets. She broke into her children's piggy bank. In one of her pages, she goes on to say that addiction will take you to some dark places, things you never thought that you would do. She went to the doctor looking for help, and she left with a prescription for 60 oxycodones. The prescription only lasted 4 or 5 days, so she would buy them off the street. Prescription opioids were safer because we don't know what is happening on the streets. The DEA gave a presentation at our opioid summit in October, which unfortunately, due to federal guidelines, was not able to be recorded and put on our website. But they stated that fentanyl powder and pills are, they described everything, how they're coming from into the States, being shipped from China into Mexico and coming up from Arizona into Utah. And that one pill might not contain any fentanyl at all. And another might be pure fentanyl, just again, because there is no regulation on that, obviously. She goes on to say a lot of people die from opioids they get off the street. And again, because they don't know what's in them. Savannah wanted recovery. She wanted help getting off pills, and her friend gave her some advice that if you mix pills with meth, the pills will last longer, and then you can eventually get off the pills. Savannah knew that methamphetamines, as she says, are hardcore. She doesn't dare do that, but she didn't want to be using pills anymore and suffering from those withdrawal symptoms. So it was something that she was willing to try. And the meth worked as far as staying in the system and not eating as many pills. She was able to stop using pills, but she was using so much methamphetamine. She was getting paranoia. She was having anxiety. She went back to the doctor for that. She was prescribed Xanax. She began snorting the Xanax. Oh, I did quote right there. That's the thing about addiction. It will take you places. I thought that was a pretty powerful quote. She started to believe that the world and her children would be better off without her. By this point, she was divorced. She had custody of her children, but she was divorced and had a new boyfriend. She had decided that she was going to commit suicide. She left her older kids with their dad and dropped the baby off with her fiance. I didn't include this one, but she went to the liquor store and grabbed a gallon of whiskey, began drinking that on the way home, grabbed all of her Xanax, laid that out, and she didn't want to leave, but that self-stigma was so deep within inside her. She felt like a failure. And you can see she's got her drawings here, her children's drawings. And obviously her children, loved their mother. They didn't know what she was going through, but she had all of this internal stigma. And at this point, she felt like she had failed and she wasn't good enough for recovery. Her mother and sister came and found her and got her into the hospital. But less than a week later, she attempted suicide one more time. She says, I'd been addicted to Xanax for a long time. I only snorted the 14 I had left. It shouldn't have hit me so hard, but it felt different. I couldn't see and I was confused. Something came over me. It was the weirdest thing. To this day, I think it was my loved ones from the other side. She ended up waking up the next day with her little dog licking her, and she knew that she needed help. She went to her parents' house and told them what she had been going through and ended up staying with them. She talked to her brother, who was a police officer, and he agreed to help her talk to her parents. And while her parents did know everything, they were still upset. They were angry, but of course they were happy that she was home with them. Like I said, Savannah's brother was a police officer. He took her to meet with detectives. And this is really where we're getting into like the one person that showed her compassion. She goes on to say that these detectives, she felt like, saved her life. They are the ones that helped her get into recovery and know that recovery is possible, because everything he said was wrapped in compassion. He said that he'll help her get into treatment and give resources, but you have to do the work. And then there was, kind of good guy, bad guy. If you go out and get high, we're going to know, and I'll be the one walking you back to your cell. She felt supported by these officers. The one gave her his card and said, please call me at any time. If you feel like you're going to use, give me a call. And she did utilize that phone number a few times and always felt supported. When I came out of my substance use disorder, I had so much self-hate and so much shame. People see the disorder as a moral failure. When I was high, it didn't bother me because I was numb. Coming into recovery, I felt that. Again, I feel like that's another powerful statement. She knew that people felt like it was a moral failing, but she didn't care when she was high. She was numb, she says. But then going into recovery, she felt that stigma. And, it makes you wonder if that is so overwhelming for these individuals and promote relapse. Um, Her therapist helped her ignore what others thought about her, helped her take back her personal power. Um, she began volunteering for USARA, which was a huge part of her recovery, is giving back to the community and helping others and spreading that awareness. She helped the local police start a peer support program and organized a fundraiser, which raised over $15,000. She goes on to say, I worked with the health department to start a harm reduction program. We offered syringe exchange, infectious disease testing, Narcan, fentanyl test strips, and recovery resources. She says that she loved going out and connecting with people who use drugs and they weren't sure where to go for resources. I guess I should say Savannah is in Price. This is where she is born and raised, in Carbon County. And she runs the Step 1 detox service in the Castle View Hospital. And they've just recently, this past April, opened in Ashley Valley Regional Medical Center, located here in Bernal. So she's over these two separate detoxes. My friend who's in long-term recovery works for the one here in Bernal and says that it's consistently full. They often have to have people like on a waiting list just because they don't have a bed available. And in December, when she shares her story, she goes on to say that when she was in active addiction, she felt stigmatized from the hospital here, and how, life does a full circle, and now she's working at the hospital. So rather interesting. But Savannah looked forward to seeing the relationships that she created were helpful in her recovery. She still faced that stigma. She was working so hard, but I had been labeled an addict. Some people made me feel like I didn't deserve recovery. She uses, again, the value of person first language. People who use drugs in my work, which values the person while recognizing their drug use behavior. The best way to support people in recovery is to have compassion, to listen to them, and to validate them. People who use drugs and people who still use drugs are your neighbors, your friends, your family. It's up to us to help them through and treat them with compassion. So that was most of Savannah's story, but like I said, I'll be shipping these out. They're going out today, and so everybody's going to receive a copy on this call, which I'm very excited for you guys to get them. So, I'd love some feedback in the chat, how you felt as I was reading that. Did it allow you to see your self-stigma? Were you able to kind of counter that in your own mind? Could you identify the root cause? Could you see Savannah as a person, compassion for Savannah? So, when we look at something as the opioid epidemic and, 100,000 deaths per year, that's such a huge number. But by doing this, we're allowed to see this is Savannah, this is a mom, a wife, a cousin, So I'd love for you to put in the chat any of these, how you felt as I read that, if it allowed you to feel any of these things. That could have been me. Yeah, that's a very valid point. Something that I think of a lot is the the stigma that I have as I'm, speaking to somebody or thinking of them before I was in this role and not really understanding, which obviously why education is so huge. But when we don't understand substance use disorder and we've been taught it is a moral failing. We look at people with that stigma from a stigmatized lens. Hi, Linda. I'm so happy you're on. Linda gave a fabulous presentation at the Opioid and Stimulant Wellness Summit in Price, and her presentation is on the website with the slides and the video, and my daughter shows cattle too, so I absolutely loved it.
Thank you. Great presentation today. I loved hearing Savannah's story through your words.
Thank you. Thank you. I appreciate that.
There is quite a few feedback on the chat. My personal reaction, it was compassionate. It does make you realize that it is only by grace that you did not walk in those shoes. Because when you see how it came to be, it could be any of us, really. Thank you.
Mm-hmm. Yeah, I have to agree with that. There's a comment in the chat. I'd like to read. That path is such a slippery slope. I have experience with addiction in my family, and the person can never understand how they got to the place of addiction. Savannah's story is a great inspiration. Yeah, I completely agree with that sentiment. One of the back to the DEA presentation at the Opioid Summit in October, they talked about that parents not understanding, how is my child getting fentanyl? They don't have a job. They're young, but Snapchat has no back doors. That the way the DEA spoke, has no back doors to where law enforcement can't figure anything out. And the people selling these pills are not afraid to take actual photographs of what they have on hand, not just using emojis, but actual photographs of the pills. And they sell them for as little as a quarter, if not giving them for free, which was shocking to hear. Does anybody have any questions on the presentation or any more comment about Savannah's story? Again, I'm excited for everybody to see these in person and have them on hand. I'll give just another second, and if there's no more questions, I really would like to ask a few of these discussion questions. And again, thinking from the perspective of somebody who's just kind of heard the story and just like your initial thoughts. And you can unmute yourself or put it in the chat, whatever works for you. Okay, so I'm not going to go through all of these questions, but I would like to ask a few. If you or someone you know is purchasing drugs off the street, what are some things you can do to be safer?
I think that's a really good question. How do you know if street drugs are safe? I mean, even if you supposedly go to a friend or an acquaintance for your drugs, how do you know if they're safe?
Exactly. And I feel like that's kind of the point there. You don't. The DEA in that presentation showed an image of a counterfeit oxycodone and a photo of a oxycodone from a pharmacy. And at the lab, he said there is no way that the technicians can sparse those two from each other. They are identical. He even said sometimes the counterfeit pills look better than the real oxycodone pills from the pharmacy. So yeah, you would never know that something is safe. It's generally not. Here's another good question. How might her doctor have helped her with her goal to stop using pills?
I have a comment on that. I'm currently a MPH student at the University of Utah, and we talk a lot about cultural humility and reflective listening. And I think if the doctor had taken the time to really look at her as a person, as well as reflect back what she was saying using the adjectives that she was saying, maybe they would have seen the deeper issue and not just tried to give her the quick fix of, oh, you have something that's working, great, let's give you more. So the doctor really missed their critical role in that moment.
I would recommend everybody here listen to Dr. Green's presentation on pharmacology. He is a family practice physician in Tooele County, I believe. He gave a great presentation at the Opioid Wellness Summit as well. Kind of hit on what you just touched on there. Here's another good one. When Savannah was released from the hospital after her first attempt to die by suicide, she tried to end her life again a week later. What might have been helpful to Savannah during this time?
Maybe a home visit by a CHW.
Definitely. Yep, definitely. Savannah found a purpose in helping people struggling with substance use disorder. What kind of services did she provide, and how do you feel this helped her in her recovery?
Can you repeat the question, Cara? Thank you so much.
Sure. Savannah found a purpose in helping people struggling with substance use disorder. What kinds of services did she provide, and how do you feel this helped her in her recovery?
If I remember correctly, she helped foster the creation of a support group. And that alone being I don't know if she was a moderator or a facilitator there, or even just someone behind the scenes, but that requires an immense amount of accountability.
Yeah, I completely agree with that. We've seen in programs such as, even the drug court program. I don't know how it is in other counties, but in Uintah County, that program works with a lot of people in long-term recovery and a lot of recovery support groups, and having those meetings and that accountability and offering service, doing service projects throughout the local communities. I mean, that gives you a large sense of pride and giving back. And I think that was for Savannah, she was giving back to those. She was helping, she was sharing her story, and the people understood that she had been there and that she had that compassion and for them. Linda, did you have a question?
Oh, I actually want to, if I could, I'd like to share a story about Savannah. That hearing you tell her story from the graphic novel makes it even more wonderful. The first time that I met Samantha in person, I met her for lunch in Price. And we had this delightful lunch. And then as we were leaving, she went to a table where a lot of the local law enforcement were having lunch and sat down with them. And when I ran back to the restroom because I was driving back to Salt Lake City, and when I came back out, she was still sitting there with them. And hearing the story today, it really cemented for me that relationship that she has with law enforcement that is deeper than I remember thinking. Isn't it wonderful that she's making those connections with law enforcement, and that there's this communication between her role as a peer recovery support advocate and law enforcement. But now hearing her story, it's even richer because I can see how
Linda, are you still there? We lost you, unfortunately. But to echo what Linda said, the relationship between law enforcement in Carbon and Emery County and USARA and those in recovery is phenomenal. It's something to definitely strive for within all of our own communities. That unique bond, I would almost call it, is pretty remarkable. Does anybody have any more questions, or can I address anything else? Kathy, did you have a comment?
Yes, I was thinking about Savannah and with the path that she chose. It's very powerful when you have that authentic story. You're not someone that's just schooled in substance abuse and disorder, but she lived it. And so that in itself will help her, that bridges that gap between the people she's trying to communicate with and help. And, you know, it helps them trust her and believe what she's telling them. So it will help them in recovery as well as herself, because she will then get that extra validation from the people that she's helping.
Yeah, wonderful. You're 100% correct. These peer support specialists are invaluable really to those in recovery, and also for when in Vernal, where I am, when somebody is in crisis, they send out a therapist and a peer support specialist to go alongside with that therapist to have that initial contact with the person. And from what I've heard, that the person that's in that long-term recovery and the peer support specialist, they understand what the person's going through. They have that initial contact with them, which eases the person's mind. And, you know, oftentimes they've had negative relationships with law enforcement, or maybe they've had court-ordered therapy, you know, things like that. So yeah, having somebody with that lived experience is always huge. USARA is statewide, I believe. Utah State University Extension, out of the Tooele office, the Tooele Opioid Response Network, has been doing free support specialist trainings. They will come to York County and host that training there for people to become these support specialists. So if that resonates with anybody, if you know anybody who might be interested in that, you could reach out to me or the Tooele Opioid Response Network. I believe it's extension.usu.edu/WARN is the acronym for that. So, but yeah, it's a free service. Well, I think I'm at about time. If there's any other questions, I'm happy to answer them. Thank you for your time. Thank you for your feedback and your comments and your questions. I really appreciate it.
Thank you so much, everyone. Thank you so much to Cara for accepting our invitation to present today. We look forward to seeing you on our next Lunch and Learn. And Pruthi, would you let us know what we have coming up, please? Thank you.
Sure. Thank you so much, Cara, for this wonderful presentation. So the next Lunch and Learn will be on January 31st. It's going to be by Kelly Meermed from the In Between Hospice Care. She'll be talking about homelessness and the cycle of homelessness, specifically in the state of Utah. You're excited for that too. Thank you.
Thank you. That promises to be another great experience. We will upload a recording of today for our AHEC scholars to obtain credit. If they were not here today, they can watch it, and it's accessible to everyone. Thank you and have a great afternoon.